Good morning, consultants, senior registrars, ladies and gentlemen. Today, we are going to be talking about the Well Man, Well Woman Clinic, and it's being presented by me, Dr. Chioma Ezenyimulu, a registrar in the Department of Family Medicine, Garaki Hospital, Abuja. So I'll be using this outline. Introduction, definition, 8 dimensions of wellness, wellness clinic and team, Wellman Clinic, Well Woman Clinic, summary references. Introduction, the concept of wellness. Wellness is a common concept often associated with health. Although wellness is a multifaceted active process that culminates in a more successful and fulfilling life, health in itself is a state of well-being that incorporates physical, mental, and social factors. This topic discusses wellness as it relates to health. Introduction. Wellness is the state of being in good health, especially as an actively pursued goal. The state of being healthy, especially when it is something that you actively try to achieve. Wellness is an active process of making optimal health and well-being choices rather than remaining in a static state, a condition obtained when a person achieves a level of health that minimizes the chances of becoming ill. The active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. Wellness definition by World Health Organization. WHO defines wellness as the optimal state of health of individuals and groups. According to the WHO, wellness has two cardinal concerns, which are the achievement of individuals' fullest potentials physically, psychologically, socially, spiritually, economically, and carrying out individuals' expectation in the family, community, place of worship, workplace, and other settings. So this brings us to the 8 dimensions of wellness. We have emotional, spiritual, intellectual, physical, environmental, financial, occupational, and social. So let us go in depth to look at the 8 dimensions of wellness. Physical wellness. This is the ability to maintain a healthy quality of life that allows us to get through our daily activities without undue fatigue or physical stress. It is making healthy and positive choices regarding a variety of issues, including nutrition, physical activity, sexuality, sleep, the use of drugs and alcohol, self-care, and the appropriate use of healthcare systems. Social wellness. This is the ability to relate to and connect with other people in the world. It is the ability to establish and maintain positive relationships with family, friends, and co-workers, thus contributing to our social well-being. It also means recognizing the need for leisure and recreational and leisure activities. Occupational wellness. This is the ability to get personal fulfillment from one's job and chosen career fields while still maintaining balance in life. Our desire to contribute in our careers to make a positive impact in the organization we work in and to society as whole. It involves continually learning new skills and seeking challenges that lead to personal growth and a better world. Intellectual wellness. This means the ability to open one's mind to new ideas and experiences that can be applied to personal decisions, group interaction, and community betterment. It is a desire to learn new concepts, improve skills, and seek challenges in pursuit of lifelong learning. It is the ability to engage in clear thinking and recall and think independently, creatively, and critically. Environmental wellness. It is the ability to recognize one's responsibility for the quality of air, water, and the land that surrounds us. It is the ability to make a positive impact on the quality of the environment, be it our homes, our communities, or our planet. Emotional wellness. This is the ability of an individual to understand himself and cope with the challenges of life. The ability to acknowledge and share feelings of anger, joy, fear, sadness, stress, hope, love, and happiness in a productive manner. In reality, it implies dealing with a variety of situations and learning how one's behavior, thoughts, and feelings affect one's decision. Spiritual wellness, the ability to establish peace and harmony in life. It is a quest for meaning, value, and purpose, resulting in hope, joy, courage, and gratitude. It is the ability to develop agreements between values and actions and to realize a common purpose that binds creation together. Financial wellness, one's relationship with money, and how it impacts one's life. Not just about how much one earns, but how one manages and thinks about finances. Achieving financial wellness means one is not constantly stressed about money. So now we go into wellness clinic. A wellness clinic is a facility that focuses on promoting and improving overall health and well-being through a variety of services, often incorporating both physical and mental health aspects. They differ from traditional healthcare settings by emphasizing preventative care and holistic approaches to health. A Wellman Clinic is a health center designed for men, which offer a range of preventive health checkup tests for men. A Well Woman Clinic is a health service clinic for preventive monitoring, health education, and advice for women. Wellness clinics. The prevalence of preventable, non-communicable diseases, NCDs, is rapidly growing worldwide. This is determined to get worse if nothing concrete is done to halt and reverse the current trend. Despite all current medical advances, the prevalence of diseases such as diabetes, obesity, hypertension, etc., are on the rapid increase. There is undoubtedly the need to shift emphasis from the current system of health system organization that focuses on treating diseases to that which emphasizes promoting healthier lifestyles and wiser personal choices. Wellness clinics. More can be done to help people living with chronic diseases or disabilities in terms of lifestyle prescription in every clinical encounter. This will lead to continual improvement of the health and quality of life of the people in the community, with the additional effect of a stable economy from a well workforce. The wellness clinic offers health services for the body and mind. It is set up to provide direct link between lifestyle changes and better state of well-being or wellness. Some focus on specific diseases or ailments, while others concentrate on enhancing inner beauty as well as outward beauties. Others combine all in one. These contemporary clinics often combine traditional medical services with alternative and complementary health options. It offers a holistic, integrated medical approach to wellness. So we talk about the wellness team. We have the chiropractor who is concerned with back pain, neck pain, alignment, etc. We have dental care, dentists, orthodontists, for eye care, ophthalmologists, optometrists, optician, fitness experts, the gym trainer, yoga instructor, Holistic care, we have acupuncture, reflexology, aromatherapy. We also have masseur for pain relief, relaxation, etc. We also have the mental health practitioner, psychiatrist, counselor, nutritionists, dietitians. We also have spa, hairstylist, manicurist, cosmetologist. We also have cosmetic services, surgeon, dermatologist, esthetician, and the family physician coordinates disease and illness management. The doctor in the wellness clinic is responsible for leadership, coordinates the unique integration of all these services under one roof or across several sites, creates, supports, and maintains wellness, enabling patients stay active, disease-free, or better quality of life in their disease condition, healthier mind, body, and spirit. Draws up organizational wellness programs, workplace wellness program, corporate wellness programs, draws up medical programs, Wellman Clinic, Well Woman Clinic. Periodic health check in adults, we use the mnemonic RISE, which stands for Risk Assessment, Immunization and Chemoprophylaxis, Screening, Education. Risk assessment in adults is based on the morbidity and mortality prevailing in the area. Also, behavioral and lifestyle patterns of individuals. High-risk individuals may also require additional screening tailored to their risk. Example, HIV screening or with the complete mapping of the human genome, genetic risk screening as well. Immunization. Immunization represents one of the most effective ways of primary prevention in primary care. It is essential to ensure that most locally given immunizations were given. Example, BCG, polio, meningitis in endemic areas, pneumococcal polysaccharide vaccine, PPV, in hemoglobin, sickle cell disease, and asplenic patients. Also, hepatitis B vaccine in occupational risk of blood exposure, healthcare providers, lab workers, hemodialysis workers, prison inmates, unvaccinated adults, and partners of HPV patients. HPV vaccine, females 9 to 13 years, and in prior abnormal pap smear, genital warts, and those with positive HPV. Chemoprophylaxis, administration of medication to prevent a disease, malaria chemoprophylaxis in pregnant women, aspirin in people with CVD risk, hematinics in pregnant women. Screening. Screening is defined as strategies representing systematic assessment used in identifying unrecognized disease in individuals without signs and symptoms. Common well adult screening preventive services. Alcohol. We use the cage or audit. Blood pressure, first visit in both arms. Intervals of 10 to 20 minutes. Colon cancer screening. Above 50 years, stop at 70 years. Do the fecal occult blood test. Flexible sigmoidoscopy or colonoscopy. Breast cancer, diabetes mellitus. Education, lifestyle modification, smoking cessation, alcohol use, moderation, nutritional education, DASH diet for hypertension, dental and oral health. So we now go specifically to Wellman Clinic. A Wellman Clinic is a specialized healthcare service focused on men's health. These clinics offer comprehensive health checkup tailored to men, encompassing various aspects like preventative screenings, lifestyle advice, and treatment for specific men's health issues. They aim to help men proactively manage their health and address potential concerns early on. Burden and risks. Men are less likely to consult their primary care physician than women. Men are more likely to experience more illness than women, more likely to have cardiovascular disease, at higher risk of committing suicide. Men also tend to take more risk with their health than women, which is reflected in higher rates of alcohol excess, smoking, poor diet, sexually transmitted diseases, and accidents. Key aspects of a well-manned clinic: preventative health screening, blood pressure checks, weight, vital signs, blood tests for conditions like diabetes, kidney disease, prostate-specific antigen PSA tests for prostate health, specialized men's health issues specific to men, such as erectile dysfunction, premature ejaculation, and testosterone deficiency. Follow-up and monitoring. After the initial assessment, clinics often provide follow-up consultations to discuss test results, offer further guidance, and monitor progress. Lifestyle counseling, focusing on diet, exercise, and stress management. So for primary prevention, here we are preventing disease and injury. For instance, for interpersonal violence, you identify the risk factors like alcohol, drug or substance abuse, low educational attainment. For road traffic injuries, for age range of 16 to 29 years, we have to identify alcohol and recreational drugs, overspeeding, fatigue, poor lighting, poor vehicle maintenance, poor visibility, poor eyesight. For cardiovascular diseases, we have to look at hypertension, look at salt intake, diabetes, glucose intolerance, dyslipidemia, cholesterol, smoking, tobacco, and alcohol, drinking, obesity, overweight, body size, physical inactivity, exercise, diet, nutrition, food, hunger, stress, mental health, urbanization, access to care, healthcare, culture, traditional healer. So these are all under primary prevention. Also for diabetes and kidney disease, we also look at hypertension, obesity, poor glycemic control, and diabetes duration when we want to look at diabetic nephropathy. Chronic respiratory diseases, we look at tobacco smoke and other forms of indoor air pollution, allergens, household chemicals, and outdoor pollution. Now we move over to secondary prevention. Here we are talking about early diagnosis and treatment. So for mental disorders, we look at socioeconomic, poverty, religious, drug and alcohol use, low level of education. For cancers, we look at smoking, alcohol use, unhealthy diet, physical inactivity, sexually transmitted diseases, HPV infection. We look at hepatitis, other carcinogenic infections, ionizing and ultraviolet radiation, air pollution. For tuberculosis, we look at smoking, HIV infection, overcrowding, previous household exposure to a patient with TB. For skin and subcutaneous infection, we look at the occupation and the environmental conditions. For STIs, including HIV, we look at alcohol, substance, drug use, multiple sexual partners, early sexual debut. For tertiary prevention, here we are looking at slowing or arresting or reversing diseases to prevent recurrent symptoms, further deterioration and subsequent events. So for STI, including HIV, we look at treating infected people, reduce stigma, increasing access to care. For cardiovascular disease, we look at major procedures to prevent recurrent symptoms, further deterioration of the disease, and subsequent cardiovascular events. So these include coronary angioplasty, stent, bypass surgery, pacemakers, defibrillators, left ventricular assist devices. For diabetes and kidney disease, we screen to identify retinopathy, nephropathy, neuropathy. For chronic respiratory diseases, we look at smoking cessation, trigger avoidance, optimization of pharmacological treatment, including anti-inflammatory agents. Now let's look at Well Woman Clinic. A Well Woman Clinic provides a range of healthcare services tailored to women's needs, including preventative care, health screening, and health education. These clinics offer a safe and supportive environment for women to discuss their health concerns and receive personalized care from qualified health professionals. Preventive care, screening for cervical and breast cancers, STI testing, guidance on healthy lifestyle choices. Health education, counseling on various topics, including family planning, menstrual problems, menopause, and general women's health issues. Sociocultural factors undermining women's health by WHO, unequal power relationships between men and women, social norms that reduce opportunities for education and paid employment, an exclusive focus on women's reproductive roles, the potential or actual experience of physical, sexual, and emotional violence. Global strides to enhance women's health. Global Strategy for Women's, Children's, and Adolescent Health 2016 to 2030. Sustainable Development Goal 3 focuses on health and well-being. SDGs 5 and 10 are focused on gender equality and reduced inequalities respectively. Maternal and child health programs. All these underscore the importance of maintaining women's wellness. Key benefits of Well Woman clinics. Accessibility. They are often accessible to women without a referral, making it easier to access timely care. Comprehensive care. They offer a comprehensive approach addressing both preventive and specific health concerns. Comfortable environment. The clinics provide a comfortable and supportive environment for women to discuss their health openly with healthcare professionals. Early detection. Regular checkups and screenings can lead to early detection and treatment of health problems, potentially improving outcomes. Common conditions affecting women's health: premenstrual syndrome, menstrual irregularities and menopause, fertility treatment, contraception, sexual dysfunction. Gynecological infections, non-communicable diseases, cancers, mental health disorders, bone and joint disease, urinary incontinence. Menstrual disorders, we have dysmenorrhea, primary or secondary, abnormal uterine bleeding, heavy menstrual bleeding, menorrhagia, intermenstrual bleeding, which can be caused by pregnancies, STI, exogenous hormones, also have oligomenorrhea and menorrhea. Management of menopause, vaginal estrogen, Kegel's exercises, use of moisturizers and lubricant, vitamin supplementation, dietary adjustment, weight, cholesterol, hormonal replacement therapy, management of infertility, assessing male and female factors for infertility, relevant investigations, addressing sexual dysfunction, introduce preconception care, couple counseling, collaboration with fertility specialists for assisted reproduction. Contraception, family planning, health indications like menstrual disorders, cardiovascular disorders, education and counseling, types and indications, awareness of side effects, gynecological infections, vaginitis, vulvitis, pelvic inflammatory disease, sexually transmitted infections, ABC of prevention, HIV-related infection, genital warts. So in summary, Well Man and Well Woman clinics provide a valuable resource for men and women to prioritize their health, identify potential issues early, and receive personalized care and guidance to maintain their well-being. Wellness is a lifestyle and not an end itself. It is dynamic and continues for a lifetime. Family care physician is in the best position to manage wellness clinics. Physicians need to be well themselves before they can offer wellness services. Hence, need to understand the concept of wellness, not only for service delivery, but also for their own well being. Thank you. And these are my references.